Cervical screening, otherwise known as smear tests, are offered to all women who have a cervix from the age of 25 to 65 years old in the UK. Cervical screening helps prevent cervical cancer by detecting high-risk HPV and any early cervical cell changes. If these changes are detected, they can be treated early to help prevent cancer developing. HPV is a very common virus that is transmitted from person to person through skin-to-skin sexual contact. This does include oral sex and the sharing of sex toys. There are no symptoms for HPV, so the only way to detect HPV is by coming in for your cervical smear tests. If you have HPV for a long period of time, it can start to cause changes to your cervical cells, and if these are not treated early, it can cause cervical cancer in the future. So ultimately, coming in for your smear test can help catch cell changes early so they can be treated and therefore prevent cervical cancer. You might be worried about coming in for your smear test or have been putting off your smear test because you think it's going to be very painful. Let me reassure you that the smear test procedure only takes a few moments. You have the right to stop at any time. I'll be as gentle as possible during the procedure, and I will also be using lubricating jelly to make it a little bit more comfortable for you. The procedure itself involves me using a single-use plastic speculum, putting some lubricating jelly on the end of it for comfort, inserting that into your vaginal opening and slightly opening the speculum until I can see the opening of your cervix. I then take a soft, flexible, silicone-like brush, pop that into the cervical opening and spin it round 5 times to collect a sample. That sample is popped into a pot and sent to the lab where it is screened for HPV. Like I said, the procedure itself only takes a few moments and you do have the right to stop at any time. If you're between 25 and 49 years old and your last smear test results were normal, then you will be invited every 3 years to come in for a routine smear test. If you're between the ages of 50 to 65 and your last smear test results were normal, you'll be invited to come in every 5 years for a routine smear test. If you've received an invite from the practice or from the NHS cervical screening programme, then please do book an appointment at reception to see me for your smear test. If you're not sure when your smear test is due, you can also speak to the receptionist and they'll let you know the date your next smear test is due. Please book in for your smear tests as they do save lives.